Most of us will live one-third of our lives in it, menopause, yet so many women arrive at it unprepared. It shows up quietly for some and crashes in for others. Hot flashes, mood shifts, sleepless nights, a body that suddenly doesn't feel like our own. Menopause isn't just a phase, it's a major medical transition, one with real biology, real options, and real misconceptions. And for decades, no one's really talked about it. But that ends here. Welcome to Understanding Menopause, an in-depth series where we break down the science, the symptoms, and solutions without the stigma. In today's episode, we're diving into the medical foundation with an expert from the CU Anschutz College of Nursing. What actually happens in the body during menopause, and why do hormones shift the way they do?
And joining me now is Dani Bulinski. She is a certified nurse midwife as well as a Menopause Society certified practitioner. Thank you so much for joining me today.
Hi, Vida. Thanks for having me.
Well, I want to talk about menopause. What is menopause and how is it defined medically?
That's a great question. And this is something that is top of mind for a lot of my patients and a really important topic. I'm so happy to be here talking about it. Menopause, defined medically, is the natural decline in our cycling hormones, namely estrogen and progesterone, among others, that decrease as we age as a loss of ovarian function. And so what that means is over time, our bodies lose the ability to mature an egg and bring about a normal menstrual cycle. And the end of that process is the cessation or stopping of menstrual periods.
And you kind of touched on it a little bit, but what causes it essentially? And is it purely hormonal? That's kind of been the big topic of debate these days.
So, menopause is a hormonally driven process. When babies are in utero, they have the most amount of eggs that they're ever going to have, and we lose them naturally, every time you have a period, but also just to a process called atresia, where some of them just don't, make it. And by the time you're in late perimenopause, the number of eggs is generally quite low. And there's a feedback loop between your brain and your ovaries. And essentially what starts to happen is that even though your brain is saying ovulate, ovulate, make another mature egg, your ovaries are no longer able to respond and mount the hormonal response that you would have that then drives your menstrual period. And there can be a number of symptoms associated with these falling hormone levels, as well as changes in your menstrual cycle, skipped periods, things of that nature.
And let's talk about the age. What age does menopause typically begin? And I know you and I have talked in the past, it can vary, be a wide variety of ages out there.
Certainly. So the average age for U.S. populations to be through menopause, which is 1 year past the final menstrual period, is age 53. But there can be a lot of variation, some of which we think is genetic or related to lifestyle factors. Any menopause having your last period prior to age 40 would be considered premature, but kind of the range for a normal natural menopause can be anywhere from 45 to 56.
Okay. Let's talk about menopause. And I think there's some confusion at times out there. What's the difference between menopause, perimenopause, and post-menopause? Take me through the process kind of from perimenopause through post-menopause.
Yeah, that's a great question. Perimenopause, peri just means around. So peri is the time when people are kind of starting to notice potentially symptoms from their declining hormone levels and might notice things like skipped periods or potentially having the early onset of night sweats or hot flashes, but they're still having a period. Sometimes monthly, sometimes people even have more frequent menses, every 21 days in perimenopause, but they have not yet started to miss periods and are certainly not 1 year without. And then once you have your final bleed and go for 12 months, we would consider you to be postmenopausal. So it's always something that we're kind of looking back at. And then, as I said, the range for that to happen can really vary. So the amount of time that someone is symptomatic can really differ. There are some people who just kind of sail through the whole thing and don't have a large disturbance in their life other than having their periods end. And there are other people that can really be symptomatic for many years as they go through this process. So it's really dependent on the person.
What are some symptoms people experience during menopause? And I know that it can be different from perimenopause to menopause to postmenopause. Explain the systems, but how your body is kind of setting you up for that whole process.
Yeah, and so kind of our like classic menopause symptoms, and this is usually kind of further along in that progression, would be, missing periods, having a couple months between cycles can be more common. Motor symptoms, which refers to night sweats, hot flashes, are really common signs of low estrogen. Vaginal dryness, and along with that, sometimes painful intercourse can be a problem for folks. Mood disturbance, sleep disturbance, people will report joint pain, cognitive concerns such as brain fog, and sometimes sexual dysfunction as well. In perimenopause, it can be really varied. And the reason that symptoms can really vary is that if you're still having fluctuations in hormones, once you're kind of past menopause, symptoms tend to be from low hormones. But actually, in perimenopause, you can be low one day, you can be high another day. And so we really have to work with people and figure out like what are the most bothersome things that are going on, because sometimes, for example, if your most bothersome symptom in perimenopause is like heavy menstrual bleeding, sometimes that can actually be from having overall higher levels of estrogen throughout your cycle that can lead you to develop a thicker lining and have a heavier bleed. And so we'll talk about this a little later on, but this is why like hormone testing on any given day is not always necessarily helpful, because it only tells us what things are looking at that particular moment in time. And you could be low one day, you could be high the next day. So it really is dependent on any particular patient and what they're experiencing.
I thought what was really interesting is that perimenopause, your estrogen levels are just kind of in overload, which seems almost counterintuitive to menopause. So it's almost like your body's going into this massive swing before menopause.
Yeah, and it definitely can depend on the person and depend like kind of how far into that menopausal transition that you are. The closer you are to your final menstrual period, which again, we don't necessarily know when that's going to be until we get there, then you are more likely to have the lower levels and along with that, the more traditional menopause symptoms with the night sweats and those sorts of low estrogen symptoms. But certainly, if you're still in your early 40s and still having more of a monthly period, sometimes the symptoms people are reporting are, like breast tenderness and heavy bleeding and things of that nature. And that actually can point to, some higher or more varied estrogen levels, which sometimes we would treat differently than if we know for sure you're experiencing symptoms of low estrogen. So
Got
that's
it.
why keeping a symptom diary is something really helpful, because you can bring that to a provider and help make sense of what's going on.
That's great advice because, like you said, everybody's body handles it differently and at different times.
Yeah, certainly. And, knowing things like if you have a sister or your mother, kind of when did they go through their menopausal transition, all of these things are kind of clues. And sometimes when we're working to help with symptoms, it can be a little bit of trial and error to figure out what is going to be the right treatment, and also depends on your personal medical history and kind of like what are the options that would be safe for you and your body as well.
Excellent. So, what about the emotional aspect? Are there emotional or cognitive symptoms tied to menopause that women often overlook that's potentially linked to menopause?
Certainly. Brain fog is a really common kind of cognitive concern that women in midlife will have. And sometimes that can be related to the sleep disturbance that is really common during late perimenopause and postmenopause. Obviously, if you're sleeping badly because you're waking up 10 times a night with hot flashes, it would make sense that you're not feeling your best at work the next day. And so certainly treating symptoms of the low estrogen, those vasomotor symptoms, and improving sleep can help with some of those things. Mood disturbance is something that we look at really carefully too, because we want to make sure that we're not missing, another medical problem that could be causing low mood or changes in mood. But certainly people will report low mood or anxiety during this transition quite commonly. And depending on what we think is kind of the root cause of that, there's various treatments that we can use to help as well.
Yeah, I know for me, going through menopause. I don't think I even realized it. I just kind of thought it was a change in life with the kids growing up and
Mhm.
heading off to college and what am I going to do there? But I think now talking to you, it makes a little more sense about some of the kind of emotional aspects.
Definitely. Progesterone, which is often used as a part of what we'll either refer to as people say menopause hormone treatment, hormone replacement treatment, or hormone therapy, they're all kind of referring to the same thing. We often will use progesterone as well, especially if someone has their uterus, they would need to take that along with their estrogen. And we know that progesterone can have an effect on people's mood as well as like supporting sleep as well. And yeah, so it kind of depends on the person and how they're feeling. And sometimes will involve, like an interdisciplinary team. Like, is there also something on in your life? As you mentioned, people, as they're going through midlife, tend to be dealing with things at work. Their kids are getting older, they might have aging parents, so there can be a lot of factors at play that can impact mood. And so sometimes it also is like a multidisciplinary approach. Like, are we seeing a therapist? Are we working on coping skills? Are we working on strengthening our relationships and asking for the support we need? And it's not always like a one size fits all answer for sure.
Really talking about kind of advocating for your own health, like really,
Mhm.
like you said, the diary, understanding all aspects of it, and then having that prepared and talking to someone who knows about menopause and menopause treatment. Because I think
Mhm.
you are certified, so you have specific training and you've seen a lot of different scenarios. So you're able to kind of tailor make a program for patients.
Certainly, yeah.
Okay. How long do menopause symptoms usually last?
It really can depend on the person. And so there are people who are symptomatic for several years before their final menstrual period. And then, 2 to 5 years after would be fairly common to still continue to experience like the hot flashes, night sweats, all of those things. Like I said, there are some people who just kind of sail right on through and are not terribly symptomatic for whatever reason. And we'll kind of talk about like who needs to take hormones and why. Certainly not every person needs treatment for their menopausal symptoms, but it's great that we live in a time where if you are having symptoms that are bothersome and they're affecting your quality of life and your sleep and your relationships and kind of all through that we've got a lot of different options now, which is great.
So, how is menopause diagnosed, and are there specific tests or signs that people need to be looking out for?
Mhm. Yeah, so menopause again, technically diagnosed based on once you have that final bleed and looking back for 12 months to say that there is no further bleeding. And there are certain hormone levels that will also indicate that someone is likely postmenopausal. And sometimes we will use this if someone, for example, had hysterectomy when they were younger for bothersome bleeding or a fibroid or something like that, and we don't necessarily have bleeding to guide us. We can use what's called a follicle stimulating hormone, which is a hormone that your brain makes that is kind of trying to tell your ovaries to do what they need to do. And so over time, that follicle stimulating hormone or FSH will rise. And so sometimes if we're not quite sure where someone is, we can test that level. And if it is reliably over 25 to 30, that's a good indication that someone is probably like through their menopausal transition. Testing our other like estrogen, progesterone levels is not nearly as helpful because in a normal, healthy menstrual cycle, levels can vary quite widely. And so, depending on where you're at in your cycle and kind of, what else is going on, it doesn't necessarily help. And so, we definitely go more off of the symptoms that any particular patient is experiencing to guide our treatment. But one thing I will say, because I don't know if this is something that everyone knows, is once you are considered postmenopause. So again, you've had your last period, it's been 12 months. Any further vaginal bleeding, whether you're on hormones or not, would be considered abnormal. And that would definitely be something to go see a provider about and get worked up because we would want to make sure that you didn't have like a uterine cancer. So definitely something good to know.
That's great advice. Yeah, I did not know that. So,
Mhm.
so how does menopause affect long-term health, like your bone density, heart
Mhm.
health, weight? You were hearing all these new kind of studies out addressing that.
Yeah, definitely. So we know that there are tissues with estrogen receptors all over our body. And so it does stand to reason that there, are different effects. And we know that the vasomotor symptoms, for example, the night sweats and the hot flashes, like that is happening in your brain. Joint pain is another common one. And, there are estrogen receptors on our bones. Estrogen does protect bone density. That is a evidence-based way or reason that we prescribe hormone therapy to menopausal women. It's a little bit more complicated when we look at outcomes for things like weight gain and even mood. Studies have been mixed on kind of if like hormone therapy by itself should be used as like a treatment. And we'll kind of talk about some of the like main studies in another segment that have kind of given us that information. But at the end of the day, if someone's main concern is, brain fog or depression or feeling low energy or weight, an experienced provider should kind of counsel you on what the data does and doesn't say. But if it's safe for you to be on hormones and you want to give it a try, some patients do report improvement. And especially if, brain fog is reported to is related to sleep and we can help your sleep, then you're likely to see an improvement. Same thing with mood. Weight gain is a little bit more complicated because body composition changes as we age. Related to weight gain specifically, it can be a little bit more complicated. We do know that our body composition does change as we age, and we think those age-related changes in metabolism are kind of occurring alongside of and independent of the menopausal transition. However, we do know that women who take hormone therapy do gain less weight, especially around their abdomen, during their menopausal transition, but that effect is actually quite small. So we're also kind of in, I think, the golden age of treatment for obesity and metabolic disease as well, which is awesome. We've got a lot of options for people if that is like your primary concern. But I would never recommend menopause hormone therapy as a primary treatment for weight, for example. That said, might you be able to exercise more and, get your steps in if you're sleeping better? So seeing a provider who can kind of explain the nuance and help with expectations, I think, is really important because there is a lot of information and kind of conflicting information coming from different places. And sometimes people are coming in thinking that hormones are going to, do all of these things that potentially we could see some help, but they're not miracles, right? We're not changing your physiology. We're not even like treating your hormone levels up to where they are normally at like the highest point in your cycle. We're just kind of giving you back enough estrogen and progesterone so that you are not having like the vasomotor symptoms, the night sweats, all of those sorts of things. So I guess that's a long answer to just say it's complicated and really kind of depends on the person.
Well, but I think information, knowledge is power, and having a wide variety of knowledge and then finding that piece that fits your puzzle.
Definitely. And I think just also using this time in life, like midlife is also a point where we can kind of look at your health overall and say, yes, we want to treat your menopause symptoms and get you feeling better, but we also want to really optimize your health and lifestyle habits so that you can be a healthy and active person, for as long as possible. And so really, looking at, are we up to date on all of our annual stuff? If we're smoking, can we stop? Are you up doing your mammograms? Are you due for a colonoscopy, which now starts at age 45? Do we need to talk about your bone density and ways to protect that? Can we hook you up with a really good primary care provider to really work with you and try and optimize? I think menopause for a lot of women, while it can be this change of life and time for bothersome symptoms, can also be an opportunity to really say like, look, you probably still have, 30 to 40 years to live, and how can we make those the highest quality that we can?
Yeah. Well, and for me, it was such a wake up call. I mean, I was so busy and so focused on taking care of my kids that I think a lot of moms and parents, they lose sight of themselves. So when the kids headed out to college, I had to kind of refocus my energy and say, okay, all that energy I put into them, I'm now going to start taking care of myself.
Mhm.
And like you said, it's like a whole myriad of things from changing the way you eat, from diet to increasing exercise to getting help on the mental health side of it. Just that combination, then the hormone replacement therapy, it's a piece of that bigger picture as we start to take care of ourselves again, I think. Dani Bulinski, thank you so much for joining us today. Great insight.
Of course. Thank you.
Next time in part 2, we're getting real about symptoms, the one everyone's heard of and the ones almost no one talks about, from hot flashes, brain fog, mood, and sleep. We're unpacking it all with clarity, science, and zero shame. If you or someone you love is going through menopause, you won't want to miss this.